saying?
You were saying we can go up to 8 watts on 980 before we're gonna add on 147 0 nanometers.
Yes. So like I was saying, if you're going to start with the 980, for the face, which includes the jawline, the cheeks, and double chin, so you can start with the 980. If you start with the 980, you can start on 5, and you go like 2 or 3 rounds. You understand what I mean? When you are doing the fanning technique, you go with 2 or 3 rounds.
And do we have to work quite slow on this frequency that you mentioned?
Yes, if you're going, you go slowly. Like, you go like 1, 2, 3, 4, 5, 6. Like, you understand, like this is you. You see the way I'm going now? You see my fingers?
Mm-hmm.
When you're down, you go in from here. When you're down like this, then you press the pedal, and then you start going slowly.
Would you advise to make a tunnel for yourself with a cannula first, or doesn't matter? Like you're just going with like one line, and then you can go with the fiber all the way down and then do it.
Okay. For me, how I go on with my procedure is first of all I do the anesthesia. How do you achieve your anesthesia? How do you give your anesthetics?
With the injections.
How?
What do you mean how?
Like how do you inject? You inject on the skin, or you use a cannula, or how do you do it?
No. Inject in the skin. With a needle in the place that we're gonna perform the procedure.
Okay. So for me, how I go along with it is usually I use pencil in this area, like I draw the lines like this, like I draw the fanning technique, like the lines I want to go, because the lines is what actually guides you during the procedure. So you have to follow the lines. You understand? You need to follow the lines for the procedure. So it helps you and it guides you, so you don't do an area so many times. Sorry, let me say. Like, so you don't have to go through an area so many times. So in that, to do that, sorry, let me press this. Can you see my screen?
Yes. Yeah.
Yeah. So you use a pencil to draw the lines like this in these areas. First of all, to guide you with the injection, and then I use a cannula. Usually I make an incision point here for the entrance of a cannula. And if I'm going to do, I usually prefer to use lidocaine with epinephrine. You know epinephrine, like, what do you call it? Epinephrine to help with the bleeding.
Yeah.
There is a small tube, it usually comes in a small tube. You can use only lidocaine, but for me, I prefer lidocaine with epinephrine, because the epinephrine helps to control bleeding. Alright? Okay, so after that, if I'm going to do, I usually use 4 ml of anesthetic, but how I constitute the 4 ml is that I put 2 ml of the lidocaine and epinephrine. It comes as a combination. In a 5 ml syringe, you put 2 ml of the lidocaine with epinephrine, and then you put an additional 2 ml of normal saline. So you're making that a 50-50 dilution. Alright? So half of it is fluid and half of it is lidocaine. Can you hear me?
Yeah.
Yeah, so when you do that, you follow the fan lines that you created already. You follow that same lines like that because it guides you with the anesthetics. So after doing that with the cannula, usually I use 22 or 22G, 70 mm, because it's long enough. If you use 50 mm may not be long enough to reach everywhere you want to go through. So I use the 70 mm 22G cannula to do the anesthetics before I go in with the fiber. So it's easy for you to go in with the fiber after that.
Okay.
Yes, you won't have any difficulty with the fiber. The most technical part about endolift is when you're putting in the fiber. Alright? But that's not a problem. So like I was saying, if we are starting with the 980, we can start with about 5. We can start with 5 and then we increase gradually until we get to 8. And if we don't achieve if we don't hear that sizzling sound, like I said, the sizzling sound is what makes you know that you are actually burning the fat. So if you don't still hear the sound at 8, then you now add the 1470. And for the 1470, you can start with 5. You can start with 5, but at most you should reach 8. Don't use the highest. Always avoid the highest until you get used to how it works. Sometimes you have to do this with about 3 patients or 4 patients before you are able to know your settings, because every doctor has their settings and they have the way they do the endolift. But my settings and my method gives you the safest and the most effective way to do endolift without any issues, without any complications.
Okay. So if we hear, for example, in 980 nanometers, on that like 8 watts, we hear the sizzling, do we need to turn at the 1470 nanometers or not?
Yes, you can still turn up the 1470 because, like, if you remember what we said if you want to reduce the fat without lifting and tightening, then you can go on with the 980. But like I said, the 980 is more scattered.
Okay.
It's more scattered and it's mostly effective for heating the skin and fat burning.
So what about clients that want to tighten the skin but they don't want to actually remove the fat?
Then you go with just 1470.
Just for the tightening, yeah?
Yes, you go with only 1470, or even if you want to go with the 980, you can go with the 980 but remain at 5. Don't exceed 5 for the 980. So you go with 1470 for patients who don't have a lot of fat and want to achieve more of lifting and tightening.
And what kind of watts we have to start? 3 to 5 as well? Or just tightening?
Yes, you can start with, if you're using 980, you can start with 5. For someone who doesn't want to burn so much fat and wants more of tightening, we start with 5, and after doing, usually the full procedure on each cheek, there's usually a counting. If you check on your machine, you see the counting of the amount of shots or pulses that you go through. For each side of the cheeks, you should have a maximum of 100 to 150 shots. Alright?
Yeah.
Matter?
Yeah, that's fine.
Okay. So you should have a maximum of 100 to 150 shots for each side. So when you start, you can start with the 980. You go with about 50 to 70 shots with the 980, and then you now introduce the 1470.
Yeah.
So if you
understand.
Yes. Okay. So if you introduce the 1470, since if you introduce the 1470, you can start with 5 also for the 1470 because you're going for tightening now. So you can use the 1470 for the rest of the period, for the rest of the shots.
Okay.
And during this period, if you want to achieve more tightening, you can increase from 5 to 6 or from 5 to 7, and then you should go if you're going to increase, like if you're doing in a 3-step level, if you're going to do with maybe say for example you go with the 980, you do for 80 shots, and then you add the 1470 at 5, and then you go up to the 150 shots, but you want to do a little bit stronger for the client, which means at this point you can increase to 7 watts for the 970. Sorry, for the 1470. You increase up to 6 or 7, and then you can do an additional 100 shots, making it a total of 250.
So, sorry, I don't get it. So you're going with the 980 nanometers to up to 80 shots, and then we switch to 1470, and we do up to 150 shots, yeah? So another 70.
Yes, and then if you want to achieve more results, like after the procedure, some people may tell you, I don't see any much difference, can we do more, I want more tightening. Then at that point, what you do is that you can increase to 7 watts. And also during this process, you also check the temperature of the cheeks. If you started with one side, you check the temperature of that side, like you check the cold side first. Then you now check the part which you're doing the procedure on. You check it again, and then you compare. Start from the side you've not done anything yet. You compare this side, then you compare this side. If you compare both sides and you notice it overheating, when I mean overheating, like really hot, at that period you leave that part of the cheeks and then you go to the other part. You can always come back to the same cheeks again.
Okay.
And complete your number of shots. So if you're going to use 250 on one side, which means you definitely have to use 250 on the second side.
Okay.
Okay?
Yeah.
But if you're going to go aggressively is 250 to 350 on each side. It's aggressive, but the actual amount, like doing a mild procedure, is usually 150 at least for a mild procedure.
Yeah, we're not going to go aggressive at the beginning.
Yeah, at the beginning, like I said, you are going to learn. Like it's endolift. Not just endolift, most of the aesthetic machines. Have you used the CO2 lasers before?
No, we use Morpheus RF microneedling.
Okay, Morpheus is not so complicated. If you use a machine that uses laser, like I'm actually trying to refer to a laser machine.
We use laser hair removal.
Yeah, not that.
That's it.
Yeah, something more invasive. So if you use any of these machines, you will find out that different machines comes with different settings. And then usually it takes about 2 or 3 clients for you to know the setting that is adequate for you to achieve the best result. So there is no harm, since it's a new machine, there is no harm in you trying to be safe, and gradually you increase.
Yeah, we will book some models to practice and to check the machine before we'll start.
Okay. And if possible, when you book your models, if possible, I can get a feedback video from you so I can assess the way you did the procedure, because today we are not doing it on any model now, so you won't really appreciate everything I'm saying now. But I think if you can send me a video after your first model, like showing how you increase and how you use change the parameters, then I would be able to tell you a little bit more.
Yeah, we will.
Okay. So now that's for the power, and then for the poles. For the poles, usually the machine we have now, which is the Hapros machine, has a maximum pulse width of 60 milliseconds. So like I said, if you're using the higher, like for example, if you're using 980 at 5 watts, and you're using 1470 at 7 or 8 watts, which means your duration should be less. Like I said previously, when the power is high, the duration should be a bit less. For some machines, it's a bit automatic, which means that when you increase the power, it reduces on its own.
Yeah.
Alright, yes. But even if it doesn't reduce on its own, you can manually reduce it slightly. But it's safe to use between 30 and 60. 30 and 60 is okay. Because the milliseconds we have, our pulse width is not too high. There are some machines that the pulse width go up to 1 second, which means you spend a lot of time, like the pulse you get in a short time, you shoot everything in one area, and those are really there for the high-tech professionals and people who have specific things they want to do with it, like they're addressing bleeding or things like that. They are the ones that use the power of the pulse width of up to 200 or 500. But for you, 60 milliseconds is still very safe. Even if you don't reduce it, it's still safe because it's reduced already. What's more important is the power. Okay, and then for the frequency, the max frequency we have is 9. You can see the screen, right?
Yeah.
Okay, the maximum frequency we can use is 9, but to be safe for the face, you can start with 5. Alright?
We are on the body now.
Okay, sorry. Face. Sorry, the safest you can use between for the face, the safest you can use is the screen wide enough, or should I increase the level? Okay. So we can use between 3 and 6 for the face, and you can still go up to 7 when your hands get stronger, when you understand the settings better.
Yeah.
The setting you matter, the settings that is good for you, that you're comfortable working with and gives you good results, may be different from that of your colleague. Your colleague may tell you, I see better results when I use this pulse and when I use this frequency, but for you, you know what works for you, and as a professional, you stay on what works for you, unless you have the kind of during the procedure you have an interaction and you get to understand what works better, and you can pick such, but anything that works for you, stick to it.
Okay.
Yes, what you understand better, you stick to it as compared to what someone else tells you. Because the person may tell you something wrong and you go try and it's a problem for you. So for the pulse, like I said, the pulse is okay. Even with 60, you're still safe. But for the frequency, don't go up to 9, go for maximum of 7 for the face. But to be safe, you can start with 4 and then you graduate to 6 or 7. You can increase the frequency as you go on, but as you are increasing the energy, you should decrease this or don't bother about this. But this is what you should be more bothered about, spending more time in one place. And also during the procedure, if you are here, you just keep going, like go in a sequential manner. Don't break and like you are here for like 2 seconds. It will damage this part of the skin. So you just, once you're in, once you reach the level you want, you move out. Once you reach this level, you move out. In the same sequence. Don't spend less time in a particular area or more time in a particular area.
Okay.
Then coming down to the fiber, which of the fibers do you have now? The diameter of the fiber. Sorry?
We have 400, 600 and 800.
400, 600 and 800.
Yeah.
Okay. The best for the face is 400.
Okay.
Yes, don't use it's only people who are professionals who have used the machine for a longer time that can use 600 for the face, because at that point you know how to maneuver the machine and how to work with the fiber effectively without causing damage. At that point you can introduce 600, but the appropriate fiber for the face is 400.
Okay.
For me, I don't use 600 for the face, but I've used it in some circumstances, and because I'm more professional with it, and I've done some trainings, which made me able to use it effectively without any problems, but I won't advise you to use it for the face.
Yeah.
And then for the fiber, the fiber comes in 3 meters.
Yeah.
So when you're using the fiber, if the fiber is this long, like my arm, usually it's only this part of my palm that goes into the client's face.
Mm-hmm.
You understand? Maybe just up to here, maybe not full my arm length. But if you use the fiber up to this point, you can use a marker to mark the points where, like, at least 3 or 4 inches away from the area that doesn't go into the patient's face.
Okay.
Yes, so I'm just giving you this trick to be able to help you to manage your fiber. So it's not ideal for you to share the fiber or repeat the fiber. But in trying to be economical, when you measure the length of the area of the fiber that goes into the face, you go at least 3 or 4 inches away from that, and then you can cut it. You have a cutter, right, that comes with the machine.
Okay.
Yes, you use the cutter, you cut the fiber, and then you to sterilize it, you don't put it in the autoclave. You rather get bleach, like methylated spirit or bleach. You can soak it in bleach or methylated spirit. It's safe to soak it in that for about 15 to 20 minutes.
Okay.
That after cutting it, then you soak it in the fiber to make it sterile for the next procedure. And then when you do that, also before the next procedure, you also try to sterilize it again. If you sterilize it again, then you have no problems, like it's going to be safe and no infection or anything.
Okay.
Okay. And then for the note here, gentle linear passes in the subdermal layer, which I already explained. Avoid superficial overheating, like what I explained to you. If you see the light bright red, which means it's superficial. So in that case, you go back and you go a little bit deeper.
Yeah.
If you don't see the light at all, or the light is very dim, you are too deep and it's not safe. So you go back and you try to stay in the subdermal layer.
Yeah.
Okay, and you can use 980 at lower powers of 2 to 3 watts in areas with small vessels. Usually, I can tell you to use 2 or 3 watts if you're doing under the eyes, but if you're using it for the face, it's a bit low.
Okay.
For the face,
we will start from 5.
Yes, 4 or 5. That is 4 or 5, but 2 or 3 is too low to have any results. Because 980 watts is up to 20 watts. So starting with 5 is too low.
Okay.
You understand? Yes, but you can always increase. For now, you're starting, you increase gradually up to 10 until you are more conversant with the Endolith machine.
Okay.
Okay. And then I'll go to the next slide for the body. So for the body, the wavelengths, you can combine both of them or you use them together. For the body, you can start with the 980. You can start with 6. All right.
Mm-hmm.
If you're going to start with the 980, you can start with the power of 6. And then when you want to add the 1470, you can start with 7, 6 or 7 for the 1470, and you can increase up to 9 watts for the body. Alright?
Okay.
Yes. So you start with 6 and you increase gradually. For the body you can increase up to 12 or 15 for the 980, but 15 is the maximum.
Okay.
From 6 you can increase to 8, from 8 you go to 10, from 10 you go to 12. But the point where you can add the 1470 is when you get up to 10 for the body. When you get up to 10, you can add the 1470 and you can start with 6 and then you increase until you get to 9.
Sorry, I thought I have to add 1470 when I'm on 7. Or are you saying on
Okay,
the 10?
I'll come again. For the 980 nanometer, you start with 6
Yeah.
for the body. Yes, and then you can increase to 8. Maybe after 50 shots, you increase to 8. Then you increase to 10. Then when you get up to 10, you can now start adding the 1470.
Okay, all right.
Yes, that's the first method. And then the
just
second
have a seat
method.
for me, okay? Sorry, it's our client just came because we had this scheduled for an hour, as she mentioned to us. So.
Okay, would you like to continue later, or should I wrap everything up?
Later,
We
what
have
time?
24 slides left.
Yeah, that's fine.
Yes, what's most important is what I'm explaining to you now, the parameters. Yes, it's most important. So for the second one now, the second model, if you want to use both of them at the same time, you can start with 980 at 6 watts.
Yeah.
And start with 1470 at 6 watts. And then you increase both of them gradually. If you increase 980 by 2, then you can increase 1470 by 1. But before you get to 9, which means you've reached up to 12 or 15 for 1470. Sorry, for 980. You should have reached up to 12 or 15 for 980 before you should have reached 9 for the 1470. But try your best not to use the highest energy for now. And then
so
for
what
the
would you say would be the max? 9? That
the
would be
max
safe
for
to
the
use?
1470 is 9. So you can stop at 8 for the body. But for the face, you can stop at 7. To be safe, avoid 9 for the 1470 for now.
Okay.
Yes, so for the body, you can stop at 8, but you can still get to 9. But when you get to 9, you know you should be doing less. Like you can do up to 20 or 30 shots with 9.
So if I understand, on the body we should start from 980 nanometers, right? And I'm just working on 980, and every 50 shots I'm increasing, let's say, to like by 2, and then when I'm on 10 watts, I'm adding 1470, and 1470 I'm starting from 6, maximum to 7.
Maximum 6 to 8 for the body.
Maximum to 8. And then that 1918 stays on 10.
Yes. Sorry,
Yeah.
980 you can get up to 12 or 15 is okay for the body. But for 1470, like I said, if you have to use 9 in 1470, don't exceed 40 shots.
40 shots.
Yes. Since you're just starting, don't exceed 40 shots if you take it up to 9. The 9 watts should be like you're trying to round up that area. So you just increase it to the highest and then you do it like 2 or 3 sweeps. You understand?
Yeah, so basically when I'm using all together, then the 980 can go up to 12 or 15, and
Yes.
the 1470 up to 8 to be safe. Maximum 2 sweeps, 40 shots.
Yes.
Yeah, okay.
Yes, and then for the pulse width, between 40 and 60 is safe.
Okay.
60 is the highest for the pulse width. So between 40 and 60 is safe.
Yeah, that's fine.
And for the frequency, you can go between 5 and 7.
Okay.
Yes.
Yeah,
And the
but
fiber you use, okay, and the fiber you use for the body, you use between 600 and 800. Usually you can use 800 if the party area is so much. Like if it's a big area, use 800. But if it's a normal body, like normal fat, not too much, you can go with 600.
And same like after we finish, we're just squeezing the fat out, yeah?
Yes. Like I said, if you got from here, if your entrance was from here, you squeeze like you squeeze this way, you try to squeeze it out. Squeeze out, you squeeze like before you finish any part of the face, you squeeze out. If you squeeze out, if oil comes out, you did a great job. If no oil comes out, you need to do more.
Okay, alright.
So for the notes, you have larger area sweeping movement. You go in a deeper plane. At this point, you don't mind so much about the light because the fatty tissue is much more dense in the abdomen. But you should also monitor the heat build up, like I said.
Okay, yeah, I get it. I have everything here.
Okay, so the next slide. This is an example of the protocol, like the face tightening, jawline and chin. Like this is, for example. Okay, don't worry about these parameters. Just use what I explained to you already.
Okay.
It's much more better than these examples I put here now. Yes. So the important tips I'll explain to you here is, first of all, use 1470 for majority of the work. It targets fat and tightens the skin. Use 980 when you need bleeding control or combine both for energy, synergy. Stay within 60 and 50 milliseconds and 90 Hz. Of course, that's the maximum you can get. Then allows monitor tissue reaction. Like you always check the skin to see if the skin is blanching. If the skin gets too white, then you should reduce the frequency. Alright? Because sometimes you might notice blanching. If there is blanching, you reduce the frequency. Or if it's too warm, or if you notice any swelling, like sometimes you might touch a bleeding vessel and it bleeds. At that point, you stop. You try to address the bleeding. You can still go on with the procedure, but you just know it's going to affect your because of the bleeding. It won't be too effective. So in such case, you can if you were about rounding up the procedure and the bleeding happens, then there is no problem. But if you just started and you had not gone so much in that area and there was a huge bleeding or hematoma and it gets swollen, in such case, you can have a repeat session for the client after about 3 weeks or 1 month. 3 weeks or 1 month, you have a repeat for the client.
So is it usually one session needed for the clients?
Yes, 1 session is enough because, like I said, you start seeing the results over 6 months.
Okay, but if they want to have another one, they can have it after 6 months.
Yes, after 6 months, they can have another one. Between 6 months or 1 year or 2 years, anyhow you want to give it to them. But at least 6 months before they have the second session of it.
Yeah.
Okay, so this is the session.
And is it any apart from the blanching skin reaction that I should be worried about, that I know that something went wrong? And is it safe on all skin types?
It's safe on all skin type, and the only thing you should be worried about usually is bleeding, which is something that you can't avoid at a point. And you are safe from bleeding if you use my method, which is retrograde. When you go in before you start the fiber out, there is a less likelihood of bleeding. But if you're going in with the power on, there is a high chance of bleeding.
Yeah.
Yes, so bleeding is the only thing you could have, and if it happens, it's okay. And the other complication you have is not usually from the endolips machine, but from the anesthesia. If you put too much anesthesia, if you go with the measurement I told you, which is 2 ml of lidocaine and epinephrine, and then 2 ml of normal saline, is enough for both cheeks. And then it's only if the client says complaints of pain, then you can increase the anesthesia a little bit. But it's better the patient feels slight pain than at the end of the day, the patient comes and tells you that I'm having droopy mouth and it's like this. You understand? That's the most common complication you get. Bleeding or the anesthesia effect.
So how much would you use on the body, or they don't need it on the body?
On the body, there is no problem. You can go up to 5 ml of lidocaine on the body. But for the face, because of the facial nerve in this area, if you give more than, you can give more than what I explained to you, but only if the client feels more pain.
Yeah.
If you notice the client is only scared, not really feeling much pain, but is just scared, go on with the procedure without anesthesia, without putting more anesthesia.
Yeah.
But if the patient is really uncomfortable, then you increase the anesthesia but you have to tell the patient these are the possibilities you would have for maybe 3 or 4 days. Your lips will come like this, or this will come like this for 3 or 4 days. After that, you'll be fine. So don't be scared.
Okay.
So for the post-care, like I said, after the procedure, make sure you squeeze like effectively, squeeze as much as you can of everything, because if you don't squeeze, it's still going to stay there and it can form solid fat again. So you squeeze as much as you can, and then you put the headgear. Usually for me, I use the crepe bandage. You know crepe bandage, right? Yes, I use crepe bandage first of all, and I put it from here up like this. Like it has to be not too tight, comfortable enough for the patient to eat, to talk and sleep without any discomfort.
So it doesn't have to be as tight as compression garments after the vaser liposuction or something like that?
Yes, the liposuction is always tight also, but it's still enough for the person to be able to do the normal activities. Because if you put it too tight, there could be necrosis because the skin wouldn't heal properly.
Yeah, okay.
Yeah, so it shouldn't be too tight. The patient should be comfortable with it to be able to wear it 24 hours.
Okay.
Yes, comfortable enough, not too tight. Comfortable enough that he can talk, he can say anything he wants to say. If it's too tight, at the end of the day, there will be no blood flow and reduced healing and inflammation continues.
Yeah, of course.
And then you place the patient, usually you can place the patient on antibiotics. It's optional, but I always love to be safe. I prescribe antibiotics and pain medication. You can prescribe ibuprofen or ibuprofen or diclofenac for pain and swelling. Alright? And do you do the HIFU? Do you use HIFU machine?
We don't use it here, but we worked on HIFU previously.
Okay, usually some clients will ask you, is there anything I can do after the procedure? Yes, because usually any client, the best clients for endolifts, first of all, are people who have had previous surgeries, like someone who had a facelift surgery. You can do the endolift for them, they will benefit best from it, after which they can do about 2 or 3 sessions of the HIFU. But after the endolift, the best procedure to aid more with the tightening and lifting is to do the HIFU after 1 month. Alright? Okay, so I'll just try to wrap up quickly. The next slide, like the post-care, mild swelling or bruising is normal.
Can we do like after 1 month Morpheus as well?
After 1 month Morpheus, yes.
Okay.
You can use Morpheus in place of HIFU.
Yeah.
Okay. And then for the post-care, avoid overeating activities for 48 hours, like avoid putting any hot thing or taking hot shower along that area. The person can use ice also on the face if the face is too warm.
Yeah.
And the person can use ice, or if you can place a cold face mask, it's also good. Use of compression garment, like I say, is very essential. And then you can have a follow-up after 2 weeks to see if the client is fine or not. And then after 1 month, you can follow up with the HIFU or the Morpheus.
Yeah.
Okay, then our last slide before we go down is maintenance and troubleshooting. Use sterile and single-use fiber. Like I said, most of the fibers are single-use, but I'm sharing you a secret to be able to help you to use your fiber longer. Avoid bending the fiber in order not to destroy the fiber. You can only roll the fiber and make it into a roll, like the way it was delivered to you. Yes, but don't bend it. If not, you destroy the fiber and it becomes useless. Clean the interface and connections. Schedule annual servicing. I think you know how to go about that. Troubleshooting. No heat on fiber. For the fibers, don't burn the fibers. Just clean, like I said, with methylated spirit or with bleach, and you're fine.
Okay. Would you be able to send us the video you mentioned you're gonna show us from the procedure?
Okay, so I'll try to share it with you.
Yeah, will you send it on WhatsApp or shall we wait here? Okay, perfect.
Yeah, I'll send to you, don't worry. Yeah. Any questions?
No, not for now. So you don't give them as well any medication for like blood clots or anything like that, just antibiotics?
Yes, like I said, antibiotics for infection, but what you give them, no need. Usually, one of the things you ask a client before the endo lift, because it's a procedure that predisposes to bleeding, you just ask the person if he or she has any bleeding disorder like delayed clotting time or increased bleeding time. If the person has increased bleeding time or delayed clotting time, then you ask also if the patient is taking medications for that. If he's taking medication for that, no problem. But if not, you can place the patient on a blood on either aspirin or any of those tablets that helps with the reducing clotting. Yes, bleeding time and clotting time, and then you can do the procedure. But if not,
and what about contraindications? Any contraindications that we have to be that exclude client apart from the?
You can exclude clients with Bell's palsy. You know the Bell's palsy?
Yeah.
Yes, clients with wasting, like clients with wasting, which means clients that's like I don't know if you understand me, like inside like wasting, and clients who are very thin and have very thin skin.
Okay.
Yes, clients with very thin skin don't need that. You can rather do the Morpheus for them or you do the hypo for them.
Okay, what about diabetics? Probably as well exclude.
Diabetes, if you're a diabetic, if you're taking your medications, if it's controlled, there is no problem. Okay. Unless it's not controlled, yeah.
And it's okay if somebody wants to do it after liposuction and have like some irregularities. It's not much fat. Just, for example, loose skin on the chin.
Yes, after liposuction, it can be done after
lipo.
Okay. Sorry to ask, are you a doctor?
Nurse.
You're a nurse?
Yeah.
Okay. I hope it's allowed for a nurse to do this in UK.
Yeah, it's allowed.
Okay. So if it's after the liposuction, about 6 to 8 weeks. In about 6 to 8 weeks, you can do the endo lift for disproportionate liposuction.
I meant like, because you mentioned that people with a thin skin, they cannot have this procedure done. So that's why I was saying like we had some clients and they had a little bit loose skin after like laser on the chin, and they wanted to have it done for skin tightening. So that would be okay. It's not much fat there. It's just like really the skin that is left.
Yes, for skin tightening, like I said, you can go with 1470 and you start with a lower energy. And for people with very thin skin, you should watch the fibers. You can use it for them also, but not very thin skin. When I mean not very thin skin, like very thin skin, it's not proper for them. But someone with like a slim, someone slim or slender, it's okay. But very thin, I don't know if you understand what I mean. Very thin skin, you shouldn't.
Like a paper.
Yes, like paper, yes, don't. But if it's someone with a normal skin, yes, you can go on with it. And then, depending on the skin texture, you should know the power you should use.
Okay.
Because you want to remain on the subdermal, you don't want to go deep into the muscle, and you don't want to be too superficial.